our CAM team who supports us in lots of things we do. And tonight we've been thinking about topics that come up a lot on Holly's Army, and one of them is gabapentin. So we thought we would go through some processes about neuropathic pain and how specific drugs work. But what we'll do first is, if you don't mind introducing yourself, Gwen.
Yeah, I'm Gwen. I did my veterinary degree, finished my veterinary degree in 2001, in the middle of foot and mouth, interestingly. But I think the important thing is I did my elective in my final year in anaesthesia. So that's what caused me to go down the route of being a specialist in anaesthesia, and that comes along with analgesia. So I did a residency in anaesthesia in 2004 to 2008, and then I was working as an anaesthetist. And just over the years, I got a bit frustrated with the lack of teaching about chronic pain and the lack of good services there are for chronic pain. So we know a lot about acute pain, and we're very good at treating acute pain. So I started to get more interested in chronic pain. And so then I moved more into analgesia, but I'm still an anaesthetist. So I work for Langford Vets, and yeah, I have a dog, and in my spare time I do all sorts of other things. I've got lots of hobbies, but often don't get time for those.
And we're busy with CAM stuff too, don't we? So
yeah.
So today we're going to talk about this thing we keep mentioning, analgesia, which means pain relief. So drugs that do pain relief. And the specific one we were going to talk about was neuropathic pain. So I wondered if you could just explain what that means. What is neuropathic pain?
Yeah, it's quite useful to get some context of what pain is, because when people talk about having pain, if you think about people saying they have pain, it's very, very complex. And pain really is just a perception of something that the brain thinks is going on in the body. Really, it's a danger signal, ultimately, in order to protect the body. But what also comes into play is, past experience on a human level, other things that are going on, anxiety, depression, things like that. But if we think about acute pain, if you injure yourself, so say a dog ruptures its cruciate ligament, what's happening there? So you've got an injury to the tissues, and you've got an inflammatory response, which is a local tissue response, which ultimately leads to healing. But that results in signals being sent up to the brain, and the brain perceives pain, and that results in a behaviour response, which means you rest the limb, you rest the leg. The dog doesn't want to go for walks, or it's limping. It might cry out if when it actually happens at first, but that's probably the only time the dog's actually going to vocalize. And then, so acute pain is useful, causes the organism to rest, and for healing to occur. Then chronic pain. So we start talking about chronic pain is when that process has been going on for a long time, and you actually get changes in the central nervous system, which are a bit like an amplifier or an accelerator. You think about the pedals on a car, chronic pain can become the accelerator, which ends up with the central nervous system amplifying what's already there. And ultimately that occurs, so the central nervous system changes result in neuropathic pain. And so traditionally we thought of neuropathic pain just as being like a nerve injury or something specifically to do with nerves and the central nervous system. But we now know that chronic pain has neuropathic elements. So we do use some drugs for neuropathic pain in diseases such as OA, for example, osteoarthritis, which weren't traditionally thought to be sources of neuropathic pain. That's a little bit muddled. I don't know how good that is, but
I think the one good thing that you've kind of explained there that I think people get confused often is the words acute and chronic. So often that's people mistaken that for severity, so how difficult or hard or painful something is, but actually it means acute means in a short period of time that it's occurred, and chronic means over a long period of time. So when we're talking arthritis, we're thinking chronic pain, and as you say, it's getting the brain processes that are all going on because of that nasty ongoing pain. So what sort of behaviours do you see commonly with neuropathic pain specifically?
So well, generally we think with chronic pain, that's the other thing that's interesting, is with chronic pain you don't get to see the same behavioural changes. As vets, we have to watch for behavioural changes. We have to watch for signs, because the animals can't explain to us that they're feeling pain. Excuse me. And so we look for behavioural change, would be our main thing we look for. And in acute pain, behavioural changes are fairly obvious to the owner, whereas with a chronic pain, because the animal's adapted to it over quite a long time, the signs are often quite subtle. And I tend to say that it's almost more the absence of a behaviour that the dog used to do, which is a signal for chronic pain. So things like not wanting to go for walks, not wanting to play, not enjoying life as much, getting snappy, things like that. So that's chronic pain. But then neuropathic specifically, if you've got some dysfunctional nerve signals going on, traditionally what we talk about neuropathic pain, you can start to get some odd sensations and describe things like tingling or stabbing. Some sensations are not unpleasant. They could just be sensations of a limb being in an odd place. If you think about an amputation pain, phantom pain, the perception that the limb is there when it's not really, that's a type of neuropathic pain. And then so there's tingling, crawling ants, burning, stabbing sensations humans describe. Animals can't describe to us. So the behaviours we are looking for that might indicate that are going to be maybe chewing his foot more than usual, and it's very specifically targeted to one foot. So that could be, there's all sorts of things that could be due to. So you need to get the vet to check that out, make sure it's not sort of a typical thing, grass seed in the foot or a cut or something on the foot. But they're chewing their leg because it feels odd. They might be getting that tingling sensation, or it might even be numb. And if an animal has a numb limb, then it's odd, it's strange, it doesn't belong to them. Then they're likely to traumatize it. You hear stories of cats traumatizing their tail if they've got a tail injury and they've got no sensation in their tail. So the tail is this foreign invader. It's like a snake and they chew it. So there's all sorts of things that happen. Neuropathic pain also, I know I think that sometimes you see dogs and cats behaving like they've just been stung by a bee, sort of looking around to bite a body part, or even sort of behaving like they think that you've just caused it. There's this odd behaviours which make owners think she's behaving like she's just been stung, or she's looking at me, or treating me like I just did something that hurt her, but nothing's happened. It's just, so it's spontaneous. And that's something else that is important about neuropathic pain, is it can be spontaneous. It doesn't need something to happen. It doesn't need the animal to move a painful joint to have the pain. It can happen while the animal's resting. So
I see quite a few dogs when they're doing those sort of shooting forwards and turning, that end up getting phobias of things because they don't understand that pain is sort of, it's not an internal pain, not an external source causing it, and then they end up being frightened of random things, and it can be odd associations that they've made. And noise is quite a common one, isn't it? Like noise phobias.
Noise phobias, this is really interesting, because I know that the behaviourist I consult about my dog is watching. But you get a lot of behavioural problems, or people going to behaviourists about problems. And the first thing the behaviourist is going to do is say, has the vet checked it? Is it possibly pain? But noise sensitivities and reactivity towards people and dogs as well is a classic. So a dog that used to be perfectly sociable with other dogs out on the street suddenly starts getting a little bit defensive, maybe snap more or they'll be, they play, even the household dog and the other, other dogs in the house, and then children in the house, they might start snapping during, when previously they would have happily played. All sorts of things like that, and snapping towards adults, not just children. And not wanting to be stroked, not wanting to be groomed, not wanting to take up their usual kind of place in the house at bedtime, wanting to be with you. I'm describing all the stuff that my dog's suffering at the moment, but I'm pretty sure she's in pain. I'm going to be talking about that tomorrow to my behaviourist.
Yeah, the list is endless of things, but I think the most common ones you see is, as you say, the licking, and that can turn into what we call a lick granuloma, where they've sort of traumatized that area of skin so badly. And often I think historically we used to think it was like an obsessive compulsive thing, and now we're definitely leaning towards the pain side of things. And I've seen a lot of dogs improve analgesia.
I think, because the other thing about lip granulomas, or anything where they're licking or chewing a limb, is that they can then create an infection in the skin, and that then perpetuates a local inflammatory response, which is an itch. Itch is a type of pain. It's got some slightly different pathways, but it's also pain, and they sort of perpetuate each other, and that's why a vet check is really important, because if they've got an infection in the skin, that needs to be resolved as well as treating the pain. Because, it's chicken and egg, which came first? Did they start chewing because they were painful and then they got a skin infection? Or did they get a skin infection and then they started chewing and actually there's no original pain at all?
Yeah, absolutely. It becomes very complex when you're examining these. But they are quite common signs of neuropathic pain, which then leads us on to how we target those. And that's a drug group that we use, and the most common one that people talk about on the Holly's Army is gabapentin. I just wondered if you could have a little bit of a chat about gabapentin as a drug.
I think it's always important to mention that we, vets will always be using the licensed drugs first, and usually they're going to want to try a non-steroidal anti-inflammatory first, and that does have some effects on neuropathic pain where it's been caused by chronic pain inflammation, and so it's still relevant. So your dog may well be on a non-steroidal anti-inflammatory, but then that's not controlling the situation, and you need to add something else. And there's various drugs available, and the one that's being used an awful lot at the moment is gabapentin. It's not usually my first choice if there's arthritis present. We can talk a little bit about some other drugs in a minute. But if we specifically suspect neuropathic pain, then gabapentin is definitely worth trying. And so basically it works in the central nervous system, and it is quite complex, and I'm definitely not going to go into the full detail because I will be with you for 3 hours if we do that. It really works as so do you remember I said about about the accelerator, pain and chronic pain causing excitation being like an accelerator on a car? So if you imagine you've got your foot stuck down on the accelerator and the car's going faster and faster and faster, gabapentin really is interrupting and slowing down the signals in the central nervous system so that you take your foot off the accelerator. It's not putting the brakes on as such, but it's actually removing that acceleration excitation. And we're starting to learn more about exactly where it acts in the central nervous system. It has other effects, so it causes sedation, and it also is an anti-seizure drug, all because it's slowing down the central nervous system. It's slowing down those connections and signals that are firing around the central nervous system. So that includes epilepsy and alertness. So sedation is a side effect. And then you mentioned, or certainly I've seen mentioned a lot, that wobbliness, or ataxia is the technical term. Well, it's not the proper term, but anyway, not being quite coordinated in the gait, and maybe even appearing to be weak in the muscles and things like that is a common complaint when dogs are put on gabapentin.
Yes.
And there are ways that we can resolve that, and it's mainly a problem with starting the dose quite high, which potentially you need to do if you want to gain control of a very painful dog. But in most situations with chronic pain, it's not appropriate to start the drug really high. So we, certainly in humans, they start the drug at a really low dose and then they gradually build up over a period of weeks. And that way you get less of those side effects with the sedation and the wobbliness.
Yeah. I've in my experience as well, with some of them where it's just a mild wobbliness, it can take 2 or 3 days, and then suddenly day 4 they seem brilliant. So generally, if it's not terrible, I might persevere with it. But again, it's very case dependent. But I know that is one of the worries that people have on Holly's Army. And in an instance where they are having a dog who is very wobbly, what sort of things should they be doing? Obviously with their vet, but what's the way to tackle that?
I think the first thing is not to be frightened of it, because it's not harming the dog in any way other than if you're talking about dogs with arthritis in context, quite often these dogs are quite weak already. They've got muscle loss and they've got painful joints. So the only danger with the wobbliness is that they can injure themselves further because of not being quite coordinated. And an absolute classic would be dogs that are having to walk around on slippery laminate floors, which is a bugbear of mine, which obviously Cam is probably a central theme of Cam, is to avoid that situation. But you get a dog with hip arthritis, muscle loss and weakness, and then add to that some incoordination and sedation weakness with gabapentin, and the dog being on a laminate floor, you've got a perfect storm. If they do the splits, they're going to injure themselves, and that's the danger. That's probably the only danger. People are very frightened of it because they've never seen their dog like this before. It's like they've just had it woken up from a general anaesthetic or something.
Yeah.
So I think what to do in that situation is call your vet and ask if you can reduce the dose a bit, and then just gradually increase it until you get the desired effect. Something else is, quite classically, a lot of vets will use twice daily dosing.
Yeah.
And there's various advice out there. We have to remember that gabapentin is not a drug that vets are traditionally taught about in the vet degree, because it's a human drug. It's not licensed for animals. Vets are allowed to prescribe it. So the education out there is a little bit more variable than what you might get in. And so a lot of vets are using it twice a day in bigger doses than you may need if you were to give it 3 times a day instead. So smaller doses 3 times a day will often get over some of these problems. And as you say, in that initial period, it does tend to wear off after a few days. But you just got to warn people that that's going to happen, so they're not surprised and not scared of it.
Yeah. And it doesn't seem to happen in every case. I suppose it's like with any drug. Some dogs are going to be more.
But it's variable between dogs.
Yeah. So you can't.
So one of the things about gabapentin.
Yeah.
One of the things about gabapentin is it's quite variable in the way it's absorbed. So the tablet's given orally, capsules given orally, and if the dog's got a full stomach, it's going to be much less is going to be absorbed, and it will take longer. Whereas if the dog's got an empty stomach, which classically happens in the middle of the day dose, then it works much more effectively. And so an individual dog might be getting its gabapentin on an empty stomach or on a full stomach. So you see variability just because of things like the owner's routine, and the vet's not necessarily able to predict how that dog's going to respond, even down to characteristics like that. Yeah. So just thinking about the timing of medication and things like that. So it's there is quite a lot of variability between dogs and how they respond in that initial period.
Yeah. And then there's another drug that we get asked about a lot, which is actually sort of a precursor, isn't it? Pregabalin. Do you mind just talking a little bit about that?
Yeah, so pregabalin is very, very similar, and it works in the same way to relieve neuropathic pain, but it's a much smaller dose needed because it's much more potent. But also I think the really fascinating thing about pregabalin, and probably why I find it more predictable, is that its absorption is much more predictable. It's got a much better, we talk about this thing called bioavailability, which is how much of the drug gets from the stomach into the bloodstream and then to the nervous system, which is where it's going to have its effect.
Yeah.
And so pregabalin is much more predictable. It doesn't really matter if you give it to a dog on a full stomach, an empty stomach, it's going to have the same effect, and it's quicker onset and slightly longer acting, so all good really. And that I do tend to dose twice a day. Occasionally a dog will need 3 times a day, but they tend to be dogs that are needing further more extreme doses and more extreme pain relief. There's some studies coming out. There's quite a lot of work being done on pregabalin, and some quite good quality studies coming out which are showing its usefulness in traditional proper neuropathic pain, such as syringomyelia. So we've got a bit more information. We're still a bit lacking in information for its usefulness in arthritis, for example, just like we are in gabapentin. There's a lot of arguments about how, if we're using these drugs appropriately in arthritic animals.
Yeah, I think that it raises a good point, really, because unfortunately in arthritis we don't always have the studies to back up what we do, and we do have to use a little bit of trial and error trying to find the right drug for a patient. And every dog is so different as well in how they process the drug, what side effects they might have, and what their disease is presenting as. So yeah, that's definitely a good point, and to sort of be open-minded when your vet's putting you onto a new drug for your pet, that you give it the time it needs, and you speak to your vet if you're having adverse side effects that you're not happy with. Going on from that then, so obviously we've kind of gone over a little bit about gabapentin and pregabalin. What other pain reliefs do you tend to use, or do you prefer? Or
I think if I've got a dog with arthritis, this is the topic we're talking about, because canine arthritis management is all about arthritis. So if that's been referred to me, it's been on non-steroidal anti-inflammatories for a while, and its pain is not controlled with that, so it's the vet's decided to refer it rather than try a human drug themselves, because really pretty much all vets have got beyond non-steroidals is tramadol as a licensed drug, and there's not really anything else. So vets will often refer to me. So I get a dog come in, it's had non-steroidals for a while. It may be not able to have non-steroidals anymore because it's had a gastrointestinal reaction, for example. The first drug I'm going to try with that dog is amantadine, which is another human drug. And there's another one called memantine, which is very, very similar. So I'm going to talk about them together. So if I say amantadine, I also mean memantine. So any of you who are listening, who've been prescribed memantine, that's the first one I would try, because it's got more, it's the first human drug that we had good, reasonable evidence behind for treatment of arthritis, preferably alongside a non-steroidal anti-inflammatory. And it works in the central nervous system to switch off, a transmission route for the excitation and amplification of this central pain. Sorry, I always get a cough when I'm talking for a while. It happens to me when I'm lecturing as well. So I'll try amantadine first. The only problem is it takes 2 to 3 weeks to see a benefit. So if the owner is not, if it's not explained to the owner that they're not going to see a change straight away, they're going to think it's not working.
Yeah.
But both gabapentin, pregabalin, and amantadine are all drugs that aren't really metabolized much by the liver, so they're pretty good drugs to use in older dogs. They're not reliant on liver function. They do need to be excreted or got out of the body by the kidneys. So, and that should be fine with anything other than, end stage renal failure. So they're pretty safe drugs to use, and in combination with non-steroidal anti-inflammatories and paracetamol also, they're safe to use along with paracetamol. So that would be my first choice. And then I would try gabapentin or pregabalin if I felt there was a neuropathic component or amantadine alone was not enough. So some animals are on 3 drugs, non-steroidals, amantadine and gabapentin.
Yes. And they do quite well with those.
Other things I've tried, it would be, so my third point of call would be, and I'm going to group these together and I'll explain why, tramadol and the antidepressants. So tramadol is not an opioid in the dog, mostly. Most dogs don't metabolize tramadol into a useful opioid for pain management, but what it does have is properties similar to antidepressants, which is working on parts of the central nervous system which help to inhibit pain.
Yes.
Help to inhibit the pain signals getting up to the brain and the brain's reaction to it. So antidepressants aren't just to stop you feeling depressed. Depression, anxiety, motivation, reward is all interlinked in the same parts of the brain or in similar parts of the brain to pain processing. So they have cross uses, and it's a bit like if a client looks up what memantine or amantadine is used for in humans, they'll go, why are you treating my dog with a drug that is prescribed for dementia in humans? And it's because it's actually working on the same the drug is working on the same receptors which actually also help with pain management.
Yes,
those are probably my main drugs that I use.
And we've kind of gone through that you generally go pretty safe to use them with other pain relief drugs, because that's the quite a common question we get on Holly's Army is, my vet's prescribed this, is it safe to still use with my Metacam or paracetamol or whatever it is that the dog's already on? And in most instances that they are pretty safe to use together. Obviously it's dog specific because you don't know, we can't talk about what other things might be going on with that particular patient, but as you say, they're quite safe drugs to use.
When, just to interrupt you there, when I did go on to then talk about tramadol and the antidepressants, so that's where you start to get into areas where you need to be careful what you're mixing. So if the dog is already on an antidepressant or for behaviour problems maybe, then you need to be careful with things like tramadol. I say careful, it's not ruled out, but the vet will be more cautious about how they prescribe and how much they prescribe. I mean, I think in reality, most of the therapeutic doses of these drugs are pretty okay to be using together. But so tramadol and the antidepressants then we need to be more careful about mixing them up.
Yeah, and I guess from talking about arthritis and the way you work your cases up, they would be your third port of call anyway. So generally those dogs probably will have tried an amantadine or memantine and then maybe tried gabapentin, and then you'd have tried one of the antidepressants. So you are talking more complex cases at that point anyway in the pain management, aren't you? I think this I think we've covered sort of the basics on those drugs. Are you happy to take some questions if I pop them up?
Yeah, it looks like there's quite a lot coming up on the commentary.
Talking about. So let's have a look. So Sarah had just asked about the value of pregabalin versus gabapentin. So we've kind of gone through that a little bit, really, haven't we?
I would say really the value of pregabalin is its predictability. It's no longer hideously expensive, and much more predictable response. But overall less experience within the profession of it. So vets are less practiced with using pregabalin, but I think if a vet is comfortable with using gabapentin, then they should launch into trying pregabalin where they see it as appropriate, because it's going to have the same effects, but more predictable.
And hopefully less side effects.
I mean, it can still have the side effects that gabapentin has, but I tend to somehow I don't see as many, and I think that's because I can start on a low dose. I can start on a dose that I can predict is going to be appropriate, whereas gabapentin, it's a bit of a
trial and error
guessing game as to what to start the dog on. How sensitive is it going to be?
Yeah. So Rachel's just said, what about dogs that are NSAID intolerant? And again, we've kind of gone through that, but that gabapentin or amantadine or any of those are, they're not licensed, but they are appropriate for neuropathic pain.
So the evidence we have for amantadine is really based on using it alongside an anti-inflammatory. It's not really thought of as a drug that we would use alone. Yeah. So quite often those dogs that can't tolerate NSAIDs, if it's because of a gut reaction, a stomach irritation, then they can tolerate paracetamol. So I've used paracetamol and memantine or amantadine together very successfully. Yeah. When an NSAID can't be given because the dog has repeatedly reacted badly to it. If we're thinking about kidney issues, then that's slightly different. We want to be very careful with paracetamol, but we potentially could still use it cautiously.
And I suppose now, in terms of being NSAID intolerant, we are starting to see more options there, and we won't go into it in great detail, but there is a new drug called Gabapentin or Gabapentin out, which is well, I think it's again a little bit dog dependent on whether they're going to get side effects, but some of the dogs that are very non-steroidal intolerant are quite tolerant of Gabapentin, so that could be an option in those cases.
I don't have much experience with Gabapentin myself yet, but I perceive that dogs that have been put onto Gabapentin, if they've got quite severe osteoarthritis pain, they're probably the ones that are then going to need something else as well. And it's fine to mix Gabapentin with these, as far as we know. And from a scientific point of view, so we talk about, there was an interesting Cam Live last week, I think, that Hannah had run, or the week before maybe, where the speaker was talking about the science-based pain medicine as opposed to evidence-based pain medicine as a human physician. And from a science perspective, there's no reason why we shouldn't use gabapentin or amantadine alongside Gabapentin. No clinical trial.
Kaz has just said that Oreo, her Chucky lab, is on day 3 of gabapentin. Apart from drowsiness, has not had any apparent side effects, so that's good.
That's good. That's what I would normally expect to see, and that's what I'd warn the owners, that hopefully then they're not going to get too wobbly, but they just will be quite sleepy for a few days, and then they'll come out of it.
So Laura, can side effects develop with gabapentin over time? So if your dog has been on gabapentin for say 6 months and appears weaker or more wobbly, could that be gabapentin, or is it likely to be progression of arthritis or another problem?
I think really the only long-term side effect I see with gabapentin is that dogs just get dull, and actually a side effect that is reported in humans is depression and suicidal thoughts. And I think I don't think that it's a problem for the when a dog is first on gabapentin, but I do think, and I haven't really explained why it's only when they've been on it long term, but they just get really dull, and those dogs I've switched to pregabalin and it seems to have resolved. And I also don't really understand why pregabalin should be better, and it might be that actually those dogs after 2 years on pregabalin will become dull. But I've not been using pregabalin long enough to have those animals come through my clinic. I would suggest it's probably more likely that the dog's weakness is progressing, and if you're having to restrict its exercise and it's getting muscle loss, I mean, if it's having physio and rehab and things like that, then hopefully you're trying to reduce that muscle loss and slow it down. But ultimately it's going to happen. That's probably more likely the cause of weakness and wobbliness, I think, or it could be another problem. You're right.
I suppose in that case, you could maybe try them off the gabapentin and swap for something else like the amantadine there, and see if there is a difference.
Maybe. So I'll often switch drugs. So the thing is not to do it too fast, or not if an animal's been on gabapentin a long time, it needs to be tapered off it slowly. It's very unlikely that it's going to get the classical side effect that vets worry about, which is a rebound seizures when they come off suddenly. But the way that gabapentin is working in the central nervous system, in the brain stem in particular, it's possible that abrupt withdrawal will almost cause a rebound effect of pain, as well as this potential for seizures is fairly extreme, unlikely, but theoretical. But I think what you're more likely to see is a rebound of the pain effects. So it should be tapered, in my opinion, if they've been on it for a very long time.
Yeah.
And then you can try, but you can start another drug straight away. So, for example, I could start amantadine straight away and taper off the gabapentin. The difficulty with that is you don't know if the dog then relapses. You don't know if that's because you took him off the gabapentin or because the amantadine is not really doing the job.
Yeah.
Or a mixture of both. So the argument would be that you do one thing at a time, but actually most of our patients, we don't want them to be in pain.
Right.
So, and also they're often elderly and only got months and years left, so we don't want to waff around too much, and so quite often we will change more than one thing at once.
Yeah. So
I've forgotten what the question was. Hopefully that's answered it.
There's just a couple of statements which I think are fairly interesting here. So Helen's just said that Jasper, her colleague's on gabapentin 3 times a day, and the side effects she's seen is urinary incontinence. Is that something you've experienced?
No, I've not seen that. I'm just trying to think why. I mean, urinary incontinence, various reasons, including at the most basic level, the dog not being able to get out the back door quick enough, or not realizing it needs to go for a wee, and so it's leaking. So I think the nature of the urinary incontinence is, I would, if in my consult room, I would be wanting to quiz the owner more about, is he incontinent? Is he aware of it? Is he having accidents, or is he just dribbling constantly? If it's having accidents, I suspect it could be to do with him not, he's sedated. He's a bit sedated with the drug. Maybe the doses could be adjusted a bit, and he doesn't get out the back door quick enough. Gabapentin can be used to treat irritable bladder and things like that. So the reactivity of the nerves that supply the bladder muscle the nerve signals are dampened down, but that's bladder muscle. It's not the bladder sphincter, which is what we tend to blame for an incontinence problem. But I'd need to think about the mechanisms, whether it could actually affect the bladder sphincter.
I don't know if this isn't to do with gabapentin, but what I do see sometimes in some dogs with like hip arthritis or issues, lumbosacral disease or whatever it may be, where they struggle to squat and they walk off as they wee. I don't think they fully void their bladder, because I think it hurts to stay squatting to toilet, and I think those dogs end up with sort of irritative bladder or leaking
or urinary tract infections, because they're not properly voiding all of their bladder contents, and so then if they get a UTI, urinary tract infection, that could cause incontinence. So it needs to be checked by a vet to make sure that he definitely doesn't have a urinary tract infection. Look at the nature of his incontinence. Is it, as I think that's a really good one, is that he walks off while still weeing because of not wanting to persist with a squat.
And then hopefully building up some muscle there, having more support will help him. If that is the scenario. Tamsin's just said that gabapentin caused noise reactivity and aggression in her dog. Is that something you see commonly?
I have heard of that as a side effect, behaviour changes, and they do report in people. You can get things like that happening in people, but it is not the norm. It's sort of an unusual side effect.
No, I've not experienced that.
But I have heard of it, in which case it's probably not an appropriate drug for that dog.
No. Chris is asking, is it better, I think we're still talking about gabapentin here, to administer on an empty stomach or with food?
For predictable effect on an empty stomach. So sometimes, when I'm talking, I spend a lot of time with my clients actually talking fine detail of timing of drugs. So you might want to give gabapentin first thing in the morning with a little ball of food if the dog doesn't take tablet. Well, most dogs won't take a tablet voluntarily, but you give it in a little ball of paste or canned food, and not with the whole breakfast. And then you wait a little bit, say 45 minutes before you feed them. I would say that's probably a more effective way to dose it. It's not a problem given on an empty stomach versus a full stomach, in that it's not going to cause any harm to the stomach, anything like that. It's just the predictability of how well it's absorbed. Empty stomach would be preferable.
Again, this is a statement rather than a question, but Janine says her 15-year-old Lacerapso has been prescribed gabapentin today. He's been showed terrible aggression recently. He's been on Metacam for 2 weeks, but still snapping at us, very out of character. So hopefully that will help.
Yeah, I mean, gabapentin is often used as a behavioural modification drug as well, and vets are increasingly using it to deal with anxiety related to clinic visits and things like that as well. So, I mean, we haven't got good studies on that, but hopefully it's going to resolve it. You know, if the snapping is to do with pain, then I'm sure it's going to help, and it should also, apart, you know, the previous statement was it actually causing aggression. It usually will tend to reduce anxiety, and often the source of apparent aggression is actually related to anxiety.
And you just mentioned, this is more of a question for me really, because I've used gabapentin quite a few times in fractious or aggressive or very worried cats. Does it work as effectively as that in dogs? Yeah,
I've got less experience using it in dogs, but certainly what I will tend to do if I've got a lot of patients that are shared with behaviourists, and their clients are quite good now at managing their dog, you know, vet visits and things like that, like a vet visit that the dog's very anxious about. So not usually coming to pain clinic, because I've been seeing them for a while, and then actually we consult in a different area. It doesn't really feel like a consulting room. But, you know, I've got some clients I've given them advice to sort of double up on the gabapentin dose before any anxiety forming event, actually. So I've got patients that have anxiety related to fireworks and thunderstorms, and their pain is in the, you know, there's one patient who has visceral pain, so pain in the abdomen rather than arthritis pain. And his signs get much worse when he's anxious, so fireworks season. And we double up the dose of gabapentin, and it completely resolves the problem. It does tend to make him want to snooze, which is fine for a short period. Most owners don't want their dogs permanently asleep, so it's not a long-term solution. But it does cause that level of sedation in dogs. But I don't have any experience myself of instructing owners to give larger doses of gabapentin prior to bringing to the hospital. I think my colleagues probably do, my surgeon colleagues, etc. But yes, it's very good for that in cats.
Melanie says, hello Gwen, I have a dog who vomited within minutes of taking amantadine and I had to stop it. Is this a common reaction?
Yes. So again, I say to all my clients, the dog is quite likely to vomit within about 20 to 30 minutes of having the tablet, but it's not something to worry about. One, because it's not to do with irritating the stomach. It's to do with, from a science point of view, I believe it's related to dopamine in the brain. So the other effect of amantadine is that it increases this level of this hormone called dopamine, and too much of it too quickly is not a good thing. And actually, the first mildest symptom of too much dopamine is vomiting, and it's to do with the brain telling the vomiting center in the brain is telling the stomach to repel its contents. It's not harmful in that respect. It's very inconvenient, but the thing is, the dog will have absorbed the capsule because that's why it's vomiting. So it has had the medication, but it's not particularly convenient for the owner to have a vomiting dog. It usually wears off after a few days, but also it's much less likely to happen if you give the amantadine with a meal, because you slow down the absorption, and so it doesn't. You don't get this dopamine rush as it's absorbed, and it affects the brain's production of dopamine. So giving it with food usually helps, and most of my clients say that they didn't have any problem with the vomiting because I've told them to give it with food.
Yeah, brilliant. Let's see what other questions we've got.
But it's certainly not a reason to stop it.
Kaylee says, interesting to know about amantadine. Thanks. I have a 13-year-old Labrador with advanced arthritis who is currently on trial leave, which is tramadol, metacam and paracetamol. I've had to do a lot of trial and error with him to find something that works for him. As you say, each dog is different and gabapentin didn't suit him. So do you think that amantadine might be a good option for her if they need more pain relief?
Yeah, it would certainly be worth asking your vet if you can try amantadine. And you have to remember that vets aren't always keen to try these human drugs if they've got no experience themselves. So vets can always call referral centres for advice. Where a referral centre has an anaesthetist, they're very likely to have somebody who looks at, sees chronic pain cases, and they're very happy to give free advice to vets about how to prescribe it safely and things like that. So, yeah. But also, trial leave, I think it's also worth making sure that you think that the trial leave is beneficial. Not all dogs benefit from it, but is probably benefiting from that antidepressant effect I was talking about, which does have an effect on pain.
Yeah. I always like to call tramadol not a pain relief, but a suffering relief, because it works on that emotional response.
Yeah.
Sarah says, is amitriptyline your psychotropic of pain management?
I don't use it very often. I've found most of my patients are getting adequate relief from the other drugs that I mentioned. I would use amitriptyline in the same way that I would use tramadol. So it's when I've got a definite. So I particularly like things like amitriptyline for dogs that have this thing called allodynia, which is when something that should be non-painful, like stroking the dog, becomes painful, becomes aversive. The dog moves away. And actually, I think amitriptyline is quite good for that. I don't have many cases to give you experience from. So if I was going to give an antidepressant or psychotropic, I think I would prefer amitriptyline over the licensed drug clomipramine, because it has a better balance between its effects on noradrenaline and serotonin, I think, for pain relief, as opposed to simply antidepressant effect. But yeah, I don't have a huge amount of experience to call on, but
Sarah says, is pregabalin controlled? Yeah. No, gabapentin is,
Same as gabapentin, it's a class Schedule 4 controlled drug. So vets have to, you have to have a written prescription in words and numbers and signed, and the actual prescription, not a copy, and all of that stuff. So yeah, and vets will only prescribe a month's worth at a time normally. I think things at the moment are not quite normal, so vets have more prescribing, slightly more lenient prescribing rules, but generally we would only prescribe a month at a time of a controlled drug, or less in some cases.
Yeah. Somebody's just asking about Fran asking any tips on weaning an animal off gabapentin. So we've kind of discussed that already, haven't we? Just saying.
Yeah, just slowly. I just titrate the dose down. So if most owners are able to open their capsule, you need to be quite dexterous to be able to open the capsule, but you could open the capsule and discard part of the content, and so you can reduce the dose that way, as well as gabapentin comes in lots and lots of different capsule sizes, so you can quite easily get even anything other than a really small dog. You can titrate the dose down, and often I'll drop all 3 doses across the day down in dose gradually over probably at least a couple of weeks. But then, once I've got to the smallest capsule size or tablet, if they're using the compounded tablets there's a couple of pharmaceutical companies that compound gabapentin into really tiny tablets for tiny dogs and cats. I would drop one of the doses out. So from 3 times a day, go down to twice a day. And then from twice a day, go down to once a day, and then stop.
Yeah. So Cam's Hannah's here. She's going to quiz us with a few questions.
Oh no, I didn't know she was watching.
Hannah said, what sort of time frame do you need to trial gabapentin for? How can you be sure it's working?
Yeah, good question. So because I don't go in at a full dose. If you go in at a high dose straight off, which often people might do for severe neuropathic pain, you should have if you go in at a high dose, you should have an effect pretty quickly, within days certainly. But because we tend to go in at a really low dose, then you're going to need to. It's going to take you a while to get up to the therapeutic dose. So we're gradually increasing the dose until we get to the point that we want. So I would say I'm looking to treat for at least 3 to 4 weeks, and usually longer, before I give up, because it's going to take me 2 to 3 weeks to get up to anything near the therapeutic dose. Yeah. But also you have to remember that chronic pain has taken months, years to form.
Yeah.
And actually we can't get rid of it overnight. So all of the chronic pain, neuropathic pain drugs, but especially the antidepressants, take longer. They take a long time to get that, what some people call wind up, or that amplification, excitability down.
Yeah. And I think in terms of how you can be sure it's working, you need to put some objective monitoring. Meaning, so you might set with your vet 3 things that you'd like to see improved for your pet, and then measure those and how they improve. But that's what I do with my patients. I tend to sort of talk about things that have most recently stopped, because that's the easiest things to start to get back. So it might be something like getting to greet them, or wanting to initiating play or something like that, and then be a bit more objective. Is that what you tend to do in your pain clinics?
Yeah, I think ultimately anything we do, we have to be measuring behavioural change. That's the only way we can measure pain in an animal.
Yeah.
Until you're getting into the realms of there are some more sort of lab-based methods to monitor pain at the brain level, but really in practice we're just measuring behavioural change, because the animal can't self-report. So it's observation. So therefore we need to write down or decide what we're going to observe to see if it changes.
Yeah, as
you say. And the vet needs to check the dog and with the client on a fairly regular basis, and that can be a telephone consult checkup to make sure that things are progressing in the right direction. It's definitely not a drug that you can just put an animal on and then not see the vet again for 6 months.
No. So that actually leads on to Hannah's next question, which is, how would you advise folk with their vets better considering these drugs? Which I think is really important, isn't it? It's an important point. How can we get a good relationship between vets and the owners to discuss these drugs? Have you got any tips with that?
I think the thing I would always say to people is to remember your vet has a lot of power in their signature, and they have a lot of responsibility. So when I say their signature, I'm talking about them writing prescription, but often they'll be dispensing out of their pharmacy. They have a lot of power to treat your dog, but they also have a lot of responsibility if something goes wrong. And so when vets are prescribing, they need to feel confident in the drug they're prescribing. And these are human drugs. So vets are not traditionally trained about these drugs at vet school. And there are no organizations like pharmaceutical companies giving good free training about, so if a vet gets if a new non-steroidal anti-inflammatory comes onto the market licensed for veterinary use, then the drug company is going to go around and do this training campaign. So they'll give free training to vets, so the vets quickly become confident in what they're prescribing. Whereas there's nobody who's going to pay for training about these human drugs that vets are allowed to prescribe, because there's no pharmaceutical company who's actually marketing them for vets, because they're not allowed to market them for veterinary use. Vets are allowed to prescribe them. So you got to give your vet a break if they seem reluctant to prescribe some of these human drugs. So I think you need to be a little bit tactful as well, because some vets can get a little jaded by clients coming in saying they've found out all this information from the internet, and the vet's sort of thinking in the back of their mind, oh yeah, but there's so much rubbish out there on the internet, and I've trained for all these years to have the knowledge to carefully and appropriately treat your dog, and you think you can diagnose it with the internet. This is a classic frustration for vets. So you've got to realize that they might, the minute you start saying, I've heard about gabapentin, or my friend's dog is on gabapentin, or that person on the internet, on Facebook, Canine Arthritis Management, said about gabapentin, and the vet's going to think, oh no, what's this about? And if the vet's not confident about it and hasn't had that extra training, which involves basically going and paying to go to a lecture to find out more about it, or extensive personal study, and that's what they're going to have to do to get confident to prescribe these drugs. So you shouldn't expect to just walk away with a human drug from a vet if they're not used to prescribing it. So be tactful, explain that you've seen a lot of evidence on something like canine arthritis management, which is becoming much better respected within the veterinary community. It's becoming well respected, within the veterinary community as a reliable source of information. So it's not just something that the owners found on Google.
Yeah, absolutely. And I think also you can always ask to be referred to somebody like yourself, and to go for a pain clinic and have a full pain.
Yeah.
And then more reassured, or that they have a person to turn to who knows the dog and knows the case, who might, like yourself, be more qualified to say, actually, yeah, gabapentin would be great in this dog, and have the confidence with that. So I think most vets would be quite open to that as well.
Yeah, and you're perfectly entitled to ask your vet for a referral. Just like if your dog needed a complex operation, your vet is likely to refer them to a specialist because they spend all their time doing those complex operations, whereas a vet in practice is very experienced with surgery, but maybe not with that complicated hip replacement operation or something. So vets are used to referring for that sort of thing, and pain clinics are a little bit less well known, and a lot of vets don't even realize pain clinics exist until they've found one, and then they tend to be heavily reliant. But most referral centers will have some form of pain advice, at least, which will be free, and probably a pain clinic. And a client is entitled to ask for a referral. So, and the other thing is that the consultant who then sees your dog in the pain clinic will not hog that patient. He or she will hand the patient back to the vet for the vet to then look after in the long term with follow-up advice. So the vet's not going to lose you as a client if you go to a referral centre for a pain consult. They're only going to learn from the experience, so it's a positive situation.
Definitely for everybody involved. Let's have a look at what we've got on here. So somebody's just Catherine's just said, what meds could you use for a dog with arthritis and Addison's disease?
Yeah, so gabapentin and amantadine should not be a problem at all. I'm just trying to think. Sorry, put me on the spot. I don't know that I've got. I see a lot of patients that can't have non-steroidals for various reasons. I don't think any of them have been Addison's patients, but
they're on Zycortal and steroids. So in most instances, there's no reason why you couldn't give gabapentin or amantadine. But again, it just depends on the case and what they're on already and what before.
I think that's more the issue, is what you can mix with the drugs they're on. So obviously they can't have non-steroidals if they're on a steroid. And as I've said before, that all of the drugs we've been talking about tonight are fine to mix with non-steroidals, and therefore they're fine to mix with steroids. But you can't mix steroids with non-steroidals. So
let's have a look what else we've got. So we've gone through quite a lot of these already, which is great.
A really good one that's just popped up. How do pet insurers view these human drugs?
Here we go.
Treatments.
Yeah,
and then somebody has replied straight away. The pet insurance will generally pay for anything that your vet prescribes. They may not pay for supplements. Some will, some won't. But if they will generally respect the vet has prescribed it because the dog needs it medically, so therefore they will pay for it.
Mm-hmm. Yeah, I've never had a problem with prescribed medication with my patients either. Somebody's asked, can you give amantadine more than once a day?
Yeah, you can. We tend to give it once a day because it's effective once a day, because it's not like, you know, if you stop memantine, it takes a few days for it to drop, the effect to drop away. So it's not like a drug that won't be effective the next day if you stop giving it for one day. So therefore, and it doesn't require, so I'm mumbling, it doesn't require an active concentration in the bloodstream in order to be having its effect. So you give the dose once a day, it gets to its place of effect, and then you know, the next day is soon enough. But you can split it into twice a day, and sometimes we do that with dogs that are very sensitive to it, like dogs that vomit. Sometimes splitting the dose across 2 doses is effective.
There's a maximum dose you can give per day, so you wouldn't give the full high dose twice a day, but you might split the full dose across multiple administrations, if that makes sense.
Yeah. Yeah, and sometimes when I've needed to ramp the dose up for a dog that, you know, you say there's a maximum dose, there's no theoretical upper limit, but you do get side effects if you up the dose. So if I feel that the animal needs more, most of the time, if it's on more than for amantadine, probably if it's needing more than, say, 5 milligram per kilo body weight, you probably need something else into the mix. Just continuously upping the dose is not necessarily the option, but some dogs need it. If I feel that a slightly higher dose is worth trying, I will split it across the day to prevent those side effects.
Brilliant. Well, I think we've answered quite a few questions there, and it's been absolutely fantastic. I've learned lots as well, which is good, and improved my own confidence in drugs I'm giving. Hopefully we've sort of talked through the most commonly used neuropathic analgesics and answered most people's questions. Obviously, if you have more questions, do feel free to comment on this post afterwards or speak to us on Holly's Army. And I'd just like to extend a huge thanks to you, Gwen, for your time and your expertise.
Pleasure.
It's been brilliant, and I'm sure everybody's enjoyed it as much as I have.
And I'll answer some of the questions that are still coming up now that we've not had time to answer. I'll have a look through.
Brilliant.
After I've had dinner.
All right. Take care, everybody. Good night.
Bye.